How to recognize and manage generalized anxiety disorder. Introduction. Anxiety is a normal part of life. Everyone feels anxious from time to time, whether it's before a big test, a job interview, or a first date. But for some people, anxiety becomes more than just an occasional worry. It becomes a constant, overwhelming presence that interferes with daily life. This is the reality for those living with Generalized Anxiety Disorder, GAD, a common but often misunderstood mental health condition. In this article, we'll explore what GAD is, how to recognize its symptoms, and practical strategies to manage it. Whether you're a teenager navigating the pressures of school and social life or an adult juggling work and family responsibilities, this guide will help you understand GAD and take steps toward a calmer, more balanced life. What is Generalized Anxiety Disorder, GAD? Generalized Anxiety Disorder is a chronic mental health condition characterized by excessive, uncontrollable worry about everyday things. Unlike normal anxiety, which is tied to specific situations, GAD is persistent and often disproportionate to the actual circumstances. People with GAD may worry about health, finances, relationships, work, or even minor concerns like being late to an appointment. This constant state of worry can make it difficult to focus, relax, or enjoy life. GAD affects approximately 6.8 million adults in the United States, with women being twice as likely as men to be diagnosed. It often begins in childhood or adolescence but can develop at any age. While the exact cause of GAD is unknown, a combination of genetic, environmental, and neurological factors is believed to play a role. Symptoms of Generalized Anxiety Disorder. Recognizing the symptoms of GAD is the first step toward getting help. Here are some common signs to look out for. 1. Excessive worry. The hallmark symptom of GAD is persistent, excessive worry about a variety of topics. This worry is often difficult to control and may feel overwhelming. 2. Physical symptoms. Anxiety doesn't just affect the mind, it can also manifest physically. Common physical symptoms of GAD include muscle tension or aches, fatigue, restlessness or feeling on edge, headaches, stomach aches or digestive issues, sweating or trembling. 3. Sleep problems. People with GAD often struggle with sleep, whether it's difficulty falling asleep, staying asleep, or experiencing restless, unsatisfying sleep. 4. Irritability. Constant worry can make people with GAD more irritable or easily frustrated, even over small things. 5. Difficulty concentrating. GAD can make it hard to focus or concentrate, leading to problems at school, work, or in daily tasks. 6. Perfectionism. Many people with GAD have a tendency toward perfectionism, setting unrealistically high standards for themselves and fearing failure. 7. Avoidance. To cope with their anxiety, some people with GAD may avoid situations or activities that trigger their worries, which can limit their lives and opportunities. The impact of GAD. If left untreated, GAD can have significant consequences for a person's life, including strained relationships. Constant worry and irritability can strain relationships with family, friends, and coworkers. Academic or work challenges. Difficulty concentrating and fatigue can interfere with performance at school or work. Physical health problems. Chronic anxiety can lead to physical health issues, such as high blood pressure, heart disease, or a weakened immune system. Co-occurring mental health conditions. GAD often coexists with other mental health conditions such as depression, panic disorder, or substance abuse. How to manage Generalized Anxiety Disorder. While GAD can feel overwhelming, it is treatable, and many people with the condition go on to lead fulfilling lives. Here are some practical strategies to help you manage GAD. Step 1. Seek professional help. The most effective treatment for GAD is a combination of therapy and, in some cases, medication. Some of the most commonly used therapies for GAD include Cognitive behavioral therapy, CBT. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to anxiety. Exposure therapy. This involves gradually facing feared situations or triggers in a controlled way to reduce anxiety over time. Medication. Antidepressants, anti-anxiety medications, or beta blockers may be prescribed to help manage symptoms. Step 2. Practice relaxation techniques. Relaxation techniques can help calm your mind and body when you're feeling anxious. Some effective techniques include deep breathing. Take slow, deep breaths in through your nose and out through your mouth. Progressive muscle relaxation. Tense and relax each muscle group in your body, starting from your toes and working your way up. Mindfulness meditation. Focus on the present moment without judgment, allowing anxious thoughts to pass without engaging with them. Step 3. Challenge negative thoughts. GAD is often fueled by negative or catastrophic thinking. Challenge these thoughts by asking yourself, is this thought based on facts or assumptions? What's the worst that could happen? And how likely is it? What's a more balanced or realistic way to view this situation? Step 4. Establish a routine. Having a consistent daily routine can provide a sense of stability and predictability, which can help reduce anxiety. Include time for work, relaxation, exercise, and social activities. Step 5. Stay active. Regular physical activity can help reduce anxiety by releasing endorphins, improving sleep, and boosting self-esteem. Aim for at least 30 minutes of moderate exercise most days of the week. Step 6. Limit caffeine and alcohol. Caffeine and alcohol can exacerbate anxiety symptoms. Try to limit your intake or avoid them altogether if they trigger your anxiety. Step 7. Build a support system. Having a strong support system can make a big difference in managing GAD. Surround yourself with people who understand and support you, and consider joining a support group for individuals with anxiety. Step 8. Practice self-care. Taking care of your physical and emotional well-being is essential for managing GAD. Some self-care practices include eating a balanced diet, getting enough sleep, engaging in activities you enjoy, setting aside time for relaxation and hobbies. How to support someone with GAD. If you have a loved one with GAD, here are some ways you can support them. 1. Educate yourself. Learn about GAD to better understand what your loved one is going through. 2. Be patient. Managing GAD is a long-term process, and there may be setbacks along the way. Be patient and supportive. 3. Encourage treatment. Encourage your loved one to seek professional help and offer to accompany them to appointments if needed. 4. Listen without judgment. Create a safe space for your loved one to express their feelings without fear of judgment. 5. Offer practical support. Help with daily tasks or responsibilities when your loved one is feeling overwhelmed. Real-life examples of managing GAD. Many people have successfully managed GAD and gone on to lead fulfilling lives. For example, Emma Stone. The actress has spoken openly about her struggles with anxiety and how therapy and mindfulness have helped her manage her symptoms. Abraham Lincoln, the former U.S. president, reportedly struggled with anxiety but used his determination and resilience to become one of the most influential leaders in history. Adele. The singer has shared how she coped with anxiety by focusing on her passion for music and seeking professional help. Conclusion. Generalized anxiety disorder is a challenging condition, but with the right support and strategies, it is manageable. By understanding the symptoms, seeking professional help, and implementing practical coping strategies, you can take control of your anxiety and improve your quality of life. Whether you're a teenager navigating the pressures of school or an adult managing work and family responsibilities, remember that you're not alone and help is available. Take the first step toward a calmer, more balanced life today. If you found this video helpful, please share it with others who might benefit from it. Don't forget to like, comment, and subscribe to my YouTube channel for more content on mental health, personal growth, and managing anxiety. Together, we can create a community of support and empowerment.